Oops, I pushed through. Hi, I'm Dr. Wallace. You're in the right place. We're going to get started pretty soon. While you're waiting, I'm going to push on the little chat so I can see if you guys talk to me. And I want to ask you what you thought this was going to be about. I love that we put out, it's going to be something about get your groove back. And I know we described what it was going to be, but if you have any particular ideas or questions before we even get started, you can send it into a little chat box and we'll see it while we wait a few more minutes, because we're going to wait probably till about 5 minutes after, because I always take a 5-minute grace period. I don't know about you guys, but sometimes it's 15 minutes, but 15 minutes would be way too much for today. So I see my highs from some of the participants. Hi, Maureen. Hi, Sarah. Hi, Representative Male Norm. We have a guy on our webinar today. And we have probably just a few more people that are going to join us. But nobody has written out what you thought it was going to be about. And by the way, we do have quizzes that are going to be happening, so hopefully you studied. Oh, hi, Lisa. I love that you guys are just sneaking in, doing a little webinar at your work from home offices. As we get going, if you guys have more questions, you can totally put them in the chat box there, and we're going to answer your questions. Oh, Maureen, I like your comment. Can't remember what it was about, but you're here anyway, so that's good. For me, it'd be kind of like anything with the word groove in it is good. It's groovy. All right, ladies and gentlemen, a couple more minutes here. So you do one. Maureen said she can't remember what she thought it would be about. Norm thinks it might be getting him more energy. Answers yes to that. I think getting more energy is a good thing. Monica says during the pandemic, quote, getting your groove back, she'll take whatever it means. Love that one. Okay. And our representative male says he's representing his wife. So I think that's sweet. Well, you'll have to take good notes then, Norm. So I'm looking at my little watch. It's just about 5 after. I think we can. Let's give everybody maybe one more minute. So I don't have a ton of slides today, but I do have quite a bit of information. So it will be really great if you have questions, just send them in. Typically, I do lots of presentations, and obviously since we're trying not to be together as much, we're doing them as webinars. But what's interesting is in my previous career as a health coach, I did tons of webinars back when webinars were not even that popular and really cumbersome, and I had to manage them technologically, and it was very, very scary. Today seems to be a much more smoother operation, so that's really good. Okay, so I think we can probably get started. We have quite a few on already, and as people jump on, they can just jump into the mix. So I think most of you know who I am, but if you come to Desert Wellness Center and see one of the other physicians, or if you're just joining us and don't know about our about Desert Wellness Center, I am Dr. Kris Wallace. I've been with the practice. Actually, I have my anniversaries coming up. It'll be about 3 years next month. I see a lot of patients, a lot of females, some males. We do a lot of hormone balancing, a lot of women's health and also men's health. I find that a lot of times as I treat women, a lot of times their spouse will come in after, because if I get one spouse feeling pretty fantastic, then the other one's like, okay, I need to keep up. So then, of course, the other spouse comes in. I also do treat children, so that's kind of another thing that part of my practice. So, but this today is going to be about get your groove back, and I'm talking about get your adult groove back. So we're going to progress through our slides, and please let me know if you have any questions. So moving forward, I added in these words defining what I thought groove would be. So motivation and drive, obviously, is part of your groove. It might be part of your jing, as the Chinese medicine might say, but just your get and go. Physical activity. If you have the energy at the end of your day to get physical activity in still, or if you can wake up in the morning and be focused enough to say, yep, I'm going to do this, I'm going to get my exercise in, then I'd say you have groove because you're motivated to get that done. Confidence. I think groove is all about confidence, motivation, drive, confidence. All of that is stuff I feel like we had potentially when we were younger, but as we age, as hormones change, and as more thoughts just kind of go through our head, we have a tendency to lose a little bit of confidence. So confidence is part of our groove. Obviously, libido and desire, potentially sexual satisfaction and intimacy. I mean, I think when we say groove, a lot of us do kind of think of that, and we are going to talk about that today. Getting in your groove is, in terms of libido, sexual satisfaction, intimacy, all that is definitely something we're going to be talking about. And I think that is part of a groove. If you are confident, motivated, and have energy, it looks like you're probably going to be more successful. So to me, having your groove is having success in whatever it is you want to do, and defined by your level of success. And then your social life. You've got to have motivation and drive in order to want to be social. I mean, one of the things that many people say when they come into my practice is, I just don't want to go out. Like, I just want to sit around all day long. I used to be super social. We used to go out all the time. And now I just kind of sit around, and I'd rather just sit down and, binge watch Netflix or whatever, instead of getting up and making kind of the effort to go out. And then finally, just having extra energy in general to spend with your kids, with your family, with each other. It takes energy to really want to do something like that. So groove, that's how I see groove. Now, I want to ask you a question. So this is your big chance. You get to answer questions. I want to ask you a question. So this question is going to be, what age do you think you should be concerned about losing your groove? So there's a little poll over here. You can answer it. So at what age should you be concerned about losing your groove? Should you be concerned around the mid-30s? Should you start being concerned right at puberty? Hopefully not. There's a lot of things to be concerned about, but maybe. Should you be concerned around 40 to 50, after menopause or andropause, or do you think, is it at any age? So what do you guys think is going to be, at what age should you be concerned about losing your groove? You got about 30 seconds. We have one answer. Come on, just click it. What do you think? Come on, this is in medical school. Just pick an answer. Do you think mid-30s, puberty, between 40 and 50, any age, menopause? When do you think all this stuff kind of starts to take a dive? So it looks like things are happening. You're voting. This is good. We're getting there. I'm going to give you all about 10 more seconds to answer. 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, we had neck and neck, any age and menopause. So any age is the trick correct answer. So any age, you should be concerned about losing your groove. Now, I know it seems weird that somebody maybe at puberty would be worried about, and I nobody answered that, but I'm going to tell you, I do see teenagers, girls and boys, especially girls, cycles get messed up, thyroid's off, they don't have a groove anymore. Absolutely mid-30s. It's when testosterone starts to leave the party, especially for females. There you go. Between 40 and 50, now you're perimenopause. All those hormones are a bit of a mess. Menopause, yeah, that's gone. And for men, andropause, somewhere around between 40 and 50 is certainly going to be a time when that groove starts to check out. So those are our answers. What gets in the way of our groove? So what's going to mess that up? Obviously, hormonal balance is a thing. I spend a lot of time trying to balance hormones. We are going to discuss a little bit about that hormone balance. We're going to have a quick, and I mean very quick, pelvic anatomy and physiology, because I remember we talked about this is kind of like pelvic stuff. Anatomy and physiology lesson real quick. We're talking about pain. Sometimes pain gets in our way. Painful cycles, urinary tract infections. I don't know if any of you have had those issues, but it's a problem, and it can be a problem later in life. Bladder leakage, no fun, gets in the way of physical exercise, gets in the way of intimacy, gets in the way of pretty much everything. And decreased sensation, dryness, laxity, all that happening can get in the way of all of those groove issues. So these are the things we're going to be talking about today. And just remember, as we move forward, if you have any questions, to just go ahead and put it in that little chat. So let's talk first about hormones. Hormones are a daily thing for me here in the office. And we love to balance those hormones, because once our hormones are in balance, then we start to feel so much better. But hormonal imbalance will affect a lot of bladder or lower pelvic issues. We get decreased estrogen, will decrease collagen, the production in the vaginal cells. So let's think about, okay, let's pull all these things together. Let's talk about, we have bladder leakage. Let's say we have UTIs. Let's say we don't have any, or we don't have any drive. Everything's just kind of bunched up. If we have decreased collagen, estrogen, and then no more collagen in the vaginal walls, we are going to have a lot more laxity. And we're going to have very weak cells in there. The decreased, then we're going to end up with leakage anytime. Bladder leakage, laughing, jumping, coughing, especially exercising, which reminds me, I saw a very funny thing on Facebook today, which is kind of ironic. Coincidental? I don't know which way I should use that word right now, but it was one of those little funny Facebook posts that says, most people are, wait, I got to read it to make sure I say exactly right. I don't want to say, people cough and worry they have COVID-19. I cough and pray that I don't pee my pants. So I thought that was kind of appropriate for what we're talking about today. So hormonal imbalance is going to get in the way, and we're going to go into a little bit more, but it's going to affect bladder leakage, going to affect UTIs, it's going to affect vaginal laxity, sensation, dryness, motivation to intimate. So all of those things are about hormonal balance. Now, we're going to take a quick look at this, and I know it's just really like technical. So just take a quick look and then you can look away. But it's important for me that you understand this anatomy a little bit. So this is a cross section. So, and the front of the body is on the left. So if you see the front of the female body, the first thing you see is the bladder, and you can see how it bumps up next to the second organ, which is the vagina, the part that's coming out, the uterus up at top. And then pushing up against that is, of course, the rectum. So those three things are just hanging out there together. When they're so close together, anything that is disruptive as we age is going to cause problems. So let's say that vaginal canal gets weak. We don't have as much estrogen anymore. We get leakage because the bladder fills up and pushes against that vaginal wall, and then we get some leakage, and we didn't want to go to the bathroom, but we are urinating anyway, especially when there's pressure. And I'll show you a different picture in a little bit about that. We're also going to be talking about UTIs, urinary tract infections, which often come from bacteria that hides in the anal canal, or comes from basically bowel movements or poop, which is E. coli. And you can see how close those two things are. So it's important to understand that all these things are very close in relationship. So when we talk about hormones or when we talk about structure, they're all very related. And it's important to look at them as a whole, which is really what naturopathic medicine does in general, but we look at everything as a whole. So we're going to keep that anatomy in mind as we move forward. Here's a little bit more hormone talk for you. Now, one of the things I promised to talk about today was pelvic pain, irregular or painful periods. Now, possibly you're not having periods anymore. That's a whole nother thing we have to talk about. And if you're still menstruating, then you have pelvic pain, irregular, painful periods, we need to look at hormonal imbalance. Too much estrogen most of the time is the culprit. Now, let's say you're kind of menstruating, you're perimenopausal, or you know someone that's perimenopausal, or you're menopausal, not really, because you had a period like 5 months ago. You have to be 12 months without a period to be menopausal. Your hormones are still fluctuating a lot. And let's say you never had issues before with your period, but now all of a sudden you're having lots and lots of bleeding. Well, that's generally because as we grow older, we're losing progesterone, and now all of a sudden we become what's called estrogen dominant. And that estrogen dominance can cause a lot of issues, a lot of bleeding, a lot more pain. So now we have too much estrogen, not enough progesterone, and we build up this huge uterine lining, which causes pain, cramping, excess bleeding, clots, things that are not maybe we were used to, but certainly treatable, and things that deserve our attention because they're getting in the way of your groove. They're decreasing your ability to be active. They're decreasing your ability to be intimate. They're also causing some havoc on your chances for potentially some sorts of cancer when we have too much excess estrogen for too long. The other thing that can cause a lot of pain, especially during periods, is the prostaglandins. So those are released later during your cycle. At the end, right before you're going to have a period, you get prostaglandins. That's inflammation. And we as naturopathic doctors know how to treat inflammation fairly well. We can adjust the hormones and, in fact, decrease inflammation. A lot of times with my younger patients, and I'm talking from the ages of 15 to about 35, 38, still menstruating, we have to deal with this inflammation issue. Or the next one down, which is this adenomyosis or endometriosis. And some of you may have heard of this, but it's certainly another issue with inflammation. These are different. It's endometrial tissue growing outside of the uterus, which is endometriosis, or adenomyosis is when you have some endometrial tissue growing in the muscle of the uterus. Either way, painful. Worse when you have too much estrogen. Worse when you have too much inflammation. So all these things we can treat. Worse also causing bladder leakage. So all these things have to be addressed in order to get rid of some of this pain. As we move on, I'm going to give you a little snippet of information on how we solve this. So let's say you had pain and you come in. We have to know what's going on. We're going to look at your lab work. A lot of times your thyroid, obviously the estrogen progesterone's in balance. That's an easy answer. But what about hypothyroidism? Maybe your thyroid's off. Maybe you have too much inflammation. We can check that in the blood work. Vitamin D makes a big deal when it comes to hormones in general. And magnesium and zinc will affect all of those things as well. Sometimes we have to look at imaging. So we need to look at, can we visualize any uterine abnormalities? Are there ovarian cysts? Do we have other abdominal issues? So we'll look at imaging. If there's irregular cycles, so let's say you're still cycling and now they're wacko, they're all out of whack, then we need to balance those cycles. We use that by giving you progesterone using vitamin D. For a lot of my younger patients and even my 30-somethings, we use seed cycling. I know that sounds so, I tell my patients this is woo-woo. This is totally get your Birkenstocks out because we are being naturopathic right now. And if you're willing to put the work in, it's not that hard. It makes a big, big, big difference. Flax seeds, and we basically divide the cycle up using flax seeds, sesame seeds, pumpkin seeds. So we're dividing your cycle up, and we're utilizing this to create more estrogen in the first half of the cycle and more progesterone in the second half of the cycle. When you do this on a regular basis, you will see the balancing of the cycle. It's very cool, and it's worked so well with some of my younger patients, and I have an example of that later. We use a lot of herbs. There are herbs that we use, chase tree berry, you've heard of yams, for progesterone. So there's herbs and foods that help a lot with balancing those cycles, as well as zinc. Zinc's a big player with that too. And then finally, inflammation solves a pain problem. Magnesium, the go-to for any inflammation. Food allergies cause inflammation, so a lot of times we'll run a food allergy profile and bring in the big guns in terms of probiotics. And sometimes you just need to cut some of those foods out that are inflammatory. So we really need to take a look at all these things when we're solving that pain puzzle. So as we move forward, we're going to talk a little bit about urinary tract infections. Ooh, wait a minute. I think I have another poll for you guys. I'm pretty sure I do. So if we look at the next question, I'm going to ask you a question here, and before we move on, I want you to answer it and see what you think. So we're going to talk about urinary tract infections because this is kind of an issue with the pelvic area. So we're going to open this one up, this poll. This question is, what foods can be irritating to the bladder and contribute to urinary tract infections? So believe it or not, foods affect urinary. Oh, somebody knew right away. That person is on it. So is it coffee? Is it tomatoes, alcohol, chocolate? What of these foods seem to be, or is it all of them that can affect urinary tract infections? Coffee. Yeah, that's a good one. Couple more seconds. We don't need a lot of time on the poll. See what you think. And or are you surprised that foods even affect the bladder? Fun fact, the lining of the bladder is literally the same as the lining of your stomach. So the tissue that's lining it is pretty much the same. So if you think this through for a minute, that's kind of a hint. And if you have reflux or GI pain when you eat spicy foods or tomatoes or alcohol or chocolate or coffee, that was a dead giveaway. So the answer is all the above. These foods create more acid in your system. I'm going to end the poll. The answer was all the above. Women over 50 have an over 50% chance of developing a UTI over their lifetime. In other words, I feel like that's low. I think that's, I don't know. There aren't very many women that can say they've never had a urinary tract infection. Usually we, diagnose it by burning, urgency, urine test, but a lot of times it's caused by that E. coli. E. coli, that bad little sucker, sets up in an acidic environment on the walls of the urinary tract and just causes all kinds of problems. Causes of urinary tract infections are generally intercourse causes it, menopause, because you have the decreased estrogen again, and you get the change in the vaginal wall, change in your urinary tract. All those changes cause the system to be more sensitive. And even though you might have always had the same partner, you still can become more sensitive to UTIs as we age because the tissue is aging in there. If immune systems are depressed, any of those things, issues emptying the bladder, all those things can cause more urinary tract infections, and most of the time they resolve. But I'm going to give you some more hints about that in just a minute. Now, before I move on, one more bladder question. Okay, I'm going to get you one more thing. You ready? This is another good one. I know it is because I wrote it. They're silly, but they're fun. So I want to know, how much urine can a healthy bladder hold during the day? These are in cups. So how much urine do you think a healthy bladder can hold during the day? This one is until you have to actually urinate. And FYI, you should urinate about 6 to 7 times a day. I don't know. That seems like kind of a lot. Depends on what you do for a living. But if you can go, how much do you think your body can hold? Nobody's guessing. You have to guess before we move on. One guess. It's kind of random. Just pick one. Anything will do. So if you guessed, oh, I forgot to show it to you. Oh, that's my fault. Sorry. Here you go. How much urine can a healthy bladder hold? 3 cups. How about anybody else? How much urine do you think can be held in a bladder? 2 cups, 3 cups? Anybody else? 1 cup. Remember, this is a healthy bladder. So this is a bladder that is strong and healthy. There's collagen, the tissue's healthy, everything's been doing, not too much acid, blah, blah, blah. So I'm going to answer the poll. Good. You guys are good. Really good. Although you have a lot of faith in your bladder, because generally we need about 1.5 to 2 cups. So 2 cups is the right answer on this one. So you don't know, if you have a really big bladder, you might be able to hold 3 cups, especially if your bladder is strong. And we'll talk about that in a minute. So looking at some prevention and treatment for your UTIs is you have to identify the source of the infection. So some women will come in and they'll be like, I have UTIs all the time. I keep taking the same antibiotic. Sometimes you have to take a different antibiotic. So your physician will do a urine test and then we'll send it out for culture. So we have to switch it sometimes. But it can also be not what bacteria it is, but where is it coming from? Is it coming from intercourse, or is it coming from even the kind of underwear that you wear? Sometimes, hate to tell you that, but thong underwear have a direct course from the rectum to the vagina and to the urinary tract and urinary tract. Just saying. So there's some things you can do. But the other thing is lots of water. If you are constantly diluting that urine and keeping it from being very acidic, it's going to be helpful. Antibiotics obviously is how we treat it, but we can also prevent it. And some women can feel it coming on, and then they can increase things like D-mannose. D-mannose keeps that E. coli from sticking to the walls. And we can treat the vaginal flora with specialized probiotics. Did you know you need a different probiotic sometimes for that UT tract versus the GI tract? And we know this, so we can treat with that. And just decrease overall acidity. Coffee is acidic, tomatoes are, anything good is acidic. Just kidding, but kind of true. So no tomatoes, no coffee, no chocolate. Just cutting back is good. But interestingly enough, we often treat, again, the UT tract of bladder, same as we will the gut. So a lot of times my patients take L-glutamine, both for the bladder infections and for the GI. So that was fun fact. Finally, we use topical treatments. We can use more estrogen cream because that'll help in there. We can rejuvenate that tissue, but guess what? Rejuvenation of the tissue is the fun thing coming up next. So that'll be good. So I gave you a little thing, pressure. This shows you how a full bladder will affect pushing against the vaginal wall, how that'll cause more leakage. You can see in this picture that a full bladder, a full bladder will really do this, but a bladder that's not as full, but a weak vaginal wall, this weak wall, this wall of the vagina right here, as that bladder hits against it, it's going to tip it and it's going to create more leakage. So the more weakness we have in this vaginal wall, the more leakage you're going to get. Decreased estrogen decreases the cells, and this can happen even after as young as age of 35. I've treated patients for weak vaginal walls using the treatment I'm going to talk about, the Viviv treatment I'm going to talk about, because there's so much leakage already at age 35. The more babies that come through that vaginal canal, the more weakness you're going to get. And sometimes it's even genetic. There's just genetic changes that have changes in the vagina earlier in life that will affect this weakness. So by strengthening the vaginal walls,
we decrease bladder leakage. And that's kind of our plan in general and how we want to do that. I know the next poll. I'm afraid to click on my next slide because I don't want to give it away. Oops, don't look. I hope you didn't see that. Okay, so I have one more poll that I'm going to give you guys. And this one is, let me show you. Okay, so we've talked a lot about hormones, how they affect your groove. In fact, hormones will decrease your desire for intercourse. It will decrease your comfort levels for any kind of intimacy. It will also decrease your motivation when you have not enough testosterone. It will cause weight gain, all of those things. But let's say once you have what's the number one physical complaint in women after they've had a pregnancy? Now, a lot of us feel like we've lost our groove after having children. And that can be because things are off, hormones are off, thyroid is off, and those are certain things we have to look at. But physically, what gets off? So this is the question. What's the number one physical complaint of women after pregnancy? Somebody already weighed in pretty strongly for that vaginal laxity. Fatigue is a good one. Obviously, once our body goes through a significant change, we will definitely see fatigue. And anytime we change our metabolism, we'll see weight gain. But we also will see things like hair loss after having babies, all those. I will have to tell you that I was, I guess, a little bit surprised by this answer at first, but now having been in this practice and doing these treatments, it makes sense to me. So most of you have weighed in on this one. So I'm going to end it. And the answer is, I'm going to show you on this next page, vaginal laxity. Number one physical complaint of women after pregnancy is vaginal laxity. If you have significant, even if you don't have childbirth, even if you're not having a vaginal childbirth. So a lot of people, obviously vaginal childbirth is going to affect the laxity because you've got babies coming out the vaginal canal. Once things stretch, sometimes it's hard for them to go back. But even if I've treated women with C-sections that have had C-sections, and as life progresses, that vaginal tissue gets weak. So we try to strengthen that vaginal tissue. The physical effects of vaginal laxity are a feeling of looseness, decreased sensation, overall a reduction in sexual satisfaction, the stress incontinence, leakage, and even vaginal atrophy. You know, and then we talk about that's obviously your groove physically, but your groove mentally or psychologically is we just lose confidence. There is a change in body image. It's a negative impact in our relationships, and obviously desire for intimacy. The reason there's no desire is because you can't feel anything and it's just no fun. One of the times we were doing a on-site presentation, and it was specifically directed at the Viviv treatment, which we're talking about at this point. We were talking about vaginal laxity, and one woman offered up the comparison as a hot dog in the Grand Canyon. So I figured, wow, that was really good. I haven't heard that before, but I'd have to say I have heard that after. So now if you get an idea of, you're not the only one. So vaginal laxity can definitely be no fun. So along with replacing hormones, we need to rejuvenate the cells. So one of the ways we rejuvenate that cells is with our Viviv treatment. So a lot of you, or maybe some of you, have heard of Viviv, but Viviv is our in-office treatment for vaginal laxity, to increase, obviously, sensation, to decrease bladder leakage. And I have to say that while everyone that's had the Viviv treatment that we've treated here knows and feels the increased sensation, and it's great, it's a lot of them came in for the treatment because of the urinary leakage. One of my, and I will say younger patients, came in because she was just like, I can't even exercise. She gained weight because she couldn't exercise anymore. Like, it's just like, I can't exercise. I'm wearing pads. I was going to have that as one of my questions, but I thought, no, that's too embarrassing. But a lot of women are wearing pads, urinary incontinence pads, some of those products. And I don't know if any of you ever follow my Instagram, but I went to Walgreens, like, I don't know, it's been a year and a half now. And I was in like the little aisle with all the urinary. Did you know that aisle is as big now as like just feminine hygiene aisle? Just urinary incontinence for women, that's like wrong. I want to pick it and say it's wrong. If you're having urinary leakage, we've got to fix it with Vivive. Vivive is radio frequency, a cryo-cooled procedure in the office. This is 30 minutes. Honestly, it's a little longer now because this slide actually came from one of my original presentations. There's actually more what we call pulses in the radio frequency now. So it's actually a better treatment. Probably it is better because there's more frequency, there's more radio frequency, there's more treatments, there's more pulses. Every time that there's a pulse in the treatment, that creates more cell rejuvenation. It is, there's no downtime. It's very safe. It doesn't hurt. As soon as that radio frequency is delivered, then the cells begin to rejuvenate. I'm going to turn my slide. Oop, nope, just kidding. So you come in, it's obviously the treatment is vaginal. So there's a wand that is inserted vaginally. And as we move that wand, it delivers radio frequency. As the radio frequency is delivered, so is cryogen. So it doesn't hurt. There's heat, but you can't feel it. And it's the heat that's rejuvenated the tissue 3 millimeters down. So once everything is done, within the next 2 weeks to 4 weeks, you feel more vaginal lubrication if you have vaginal dryness. The tightening, the less stress urinary incontinence, usually you can feel that by about a month. And then as you move forward, by 90 days, all of that tissue has been rejuvenated. And about you can expect 90% of that leakage to be gone. I've retreated about 2 of my patients in the last 3 years. So most of the time, you do not need another treatment. It is a one and done. And there's other things on the market, but they're definitely not they're not one and done. They're lasers and they hurt and they hurt. I wouldn't recommend them, but you need more than one treatment as well, 3 treatments. So that's Vivive. It's a really great treatment as well for vaginal dryness, which comes along as we age. If you're not or unable to treat with estrogen, there are a few women that can't use estrogen because they have had either breast cancer or they've got some other negative effects of estrogen in their system. So we can still treat at least vaginally to take care of that dryness by this treatment, which I think is really great. So if we look on, I wanted to give you just a couple of case studies before we move on. People always like to know, well, did that work or what happened? So a couple of patients, dealing with everything we talked about today. I had a 50-year-old that was seeing me for ongoing pelvic pain. She was menopausal, but she'd been having pelvic pain since she was in her 30s. And I'm talking about pain with intercourse, pain throughout the day. She's had a lot of pain and she just never knew what it was. So once we did labs and figured everything out, she was obviously menopausal. So we started her with pellet therapy, which is what we use for a lot of our patients for hormones. Once we got our estrogen levels up, our progesterone levels up, testosterone levels up, replaced her thyroid. And then we also added some vaginal estrogen cream. Her pain was decreased by 90%, and it continued. That pain has continued to decrease over the last year. So, and this woman had been living with this pain for 20 years. So there's no reason to live with pain. There's no reason to live with pelvic pain. We can take care of that. Another example, I have a 17-year-old that I treated. A lot of athletes, 16, 17, 18 come in, no cycle. We identified Hashimoto's, which is a big problem with the thyroid, and we added seed cycling. It only took 2 months for her period to come back, and she'd been missing it for a year. But not only that, but she's 17. She had didn't have groove. She didn't have motivation. She didn't have drive. She didn't have any hormones. So we had to give her back her hormones. We did that with seed cycling, and we did that with balancing her thyroid. So, and then my 35-year-old, she'd had 3 vaginal births. Her final, she had been contemplating doing BIVEV. So she was already my patient, contemplating having this done. And she went to a concert, which she was late for, and she had to run from the parking lot to where the concert was being done. And by the time she got there, she had to completely change her clothes because urine leaked everywhere. That was her final straw. She came in and did BIVEV. She hasn't had any leakage since. Interestingly enough, we talk about vaginal laxity and how it goes away, how you feel more sensation and all of that. Turns out I've had a lot of referrals, not from her, but from her husband. So you guys can think about what that might mean. So yeah, it definitely is a nice little side effect in terms of the intimacy, satisfaction. Obviously, not having any bladder leakage was a big deal for her. And then finally, this is a really recent comment. This is hilarious. Older patient, 62. She'd had vaginal births, vaginal dryness. I'm treating her with hormones. She also did the BIVEV treatment. She had severe stress urinary incontinence, so she came in. We did the BIVEV treatment, and it took care of that. It took care of her vaginal dryness. She was very happy. But the funniest thing she shared with me was she went in because she had to go into a regular gynecology appointment. She had a pap smear done. And her GYN commented on her youthful vaginal tissue, which I'm like, are you kidding? Did they say that for real? And she's like, yeah, she really said that. So that's good. And I'm like, I guess that is good. So you can go show the youthful vaginal tissue. So those are just kind of some examples of kind of how we touch on all things pelvic related, all things hormone related, mostly taking care of that stress urinary incontinence. Which will, in the end, make life much better and absolutely get your groove back. So I want to open it up for any questions. I know that some people have joined us that are already our patients and wanted to just learn a little bit more about something here or there. I also know that some of you have joined that are not our patients. So if you have any questions at this point, it would be a good time to type them into the chat, and then I can answer them for all of you. In the meantime, while you're typing up your question, I want you the screen that's being shown right now is kind of our little webinar special. We have specials with all of our webinars. First one is if you are not a patient right now and want to learn about getting your groove back in terms of hormone therapy or whatever it might be, it's $50 off your first patient visit, which is nice. Also, if you're interested in the BIVEV treatment I talked about for stress urinary incontinence, vaginal laxity, taking care of all of that, that's a $500 off coupon. So if you call, book it, and then say that you found the information on a webinar, then you'll be able to get both of those specials. And you don't have to be a patient of ours to do BIVEV. In fact, I have treated several patients that have found us through our website that were actually looking for a BIVEV treatment. And funny thing is they became our patients. So just beware. If you come in for BIVEV, you'll end up being one of the patients too. So any questions out there right now, just go ahead and put them in the chat and we can answer that. Wow. One of the questions that I had is, will my partner notice that I've had that BIVEV treatment? In other words, does it go both ways? I might notice it, but will my partner notice? And I kind of alluded to that in my last example that I gave of one of my patients. And the answer is yes, they do notice. So kind of like the hot dog in the Grand Canyon thing, they'll probably notice a little bit more tightness. So that's a good thing. Good question. Some people want to know, how quickly am I going to get results? And I know I probably have been talking really fast because I want to be mindful of your time and mention this, but in the order of you noticing results, most patients notice vaginal lubrication more first 2 weeks. Stress urinary incontinence start to take effect in the first month for sure. And then After that, within the 90 days time frame, that's when it takes all your cells to kind of rejuvenate. So 90 days is when you feel all of the great results of having the IV treatment. And one of the questions I have is, do I have any suggestions for vaginal dryness in terms of supplements? So obviously the first thing we do for vaginal dryness is measure estrogen and supplement it via pellets, creams, or vaginally. So what I recommend, if you're not appropriate for estrogen pellets or estrogen replacement at this point, I will use a very low dose estriol cream that's directly inserted into the vagina. When we do that, it treats just those cells and is very good for rejuvenating a little bit, just kind of helping out a little bit with the dryness. Supplement wise, maca powder. So maca powder is known as the fertility herb. And maca is kind of one of those things that I'll give patients who just overall have low hormones, aren't ready for replacement, just need a little boost. Sometimes that will help with the vaginal dryness. So maca powder on its own, you can try that. And then some of our herbal supplements like chaste tree berry, which is Vitex, that is found within some of our combinations. Fem Rebalance, that's by Designs for Health, is a good one, or Fem Rebalance by Vitex, sorry, or by Botanica, that's a good one. And then there's other formulations specifically for menopausal women, one by Botanica as well, called Women's Phase 2. So some of those oral supplements will help. I did have a question on how much does Viviv cost? And I think that's a really fair question. And you have to repeat it. First of all, the repeat is, I haven't seen it. I have a patient, my longest patient out there right now I probably treated her 4.5 years ago. And things are still good. But it does say every now and then we will have to repeat, maybe at 5 years, depending on how you're taking care of yourself. In other words, if you're replacing estrogen, you got the Viviv, you're replacing estrogen. If you're too young to replace estrogen, are you taking your regular supplements? Are you taking vitamin D? Even something like fish oil will help. So are you taking care of yourself? That will keep your results longer, because remember, your results are based on the fact that you've rejuvenated cells. You want to keep those new cells healthy. So if we keep those new cells healthy, repeat won't be as likely. The cost of Viviv, remember we're doing the $500 off. So for you, it would be $2,500. That's one treatment. So if you look on the market and you see other types of vaginal rejuvenation, you will see lasers, and they will market themselves at $9.99 per treatment, which you got to get 3 of them, or $8.99 a treatment. But they hurt, and they're burning tissue in order to get rejuvenation. We are not burning tissue here, ladies. We're not putting anything in you that's going to hurt. So it's a one-time treatment. Most of my patients do find that once they're done, it's the best thing they ever did. So we do find that HSA accounts will pay for that, but it's obviously not something that's going to be covered by insurance, because they never cover anything good. Just kidding, but kind of not. So that's where it's at. So it's regularly $3,000, but with your $500 off, it's $2,500 for the treatment. When you call in and you schedule, if Viviv is something you want, they'll usually take a deposit from you for that, and then we just set up your schedule and you come in and we get it done one time in the office. So, and it's always done by doctors. I mean, if you call in for this offer, I will do your treatment, but nobody ever does your treatment but a doctor here. It does it wellness when it comes to Viviv or any of the stuff that we do, except for great, amazing blood draws by Alyssa or Curly. Okay, and we have one more question. And is there any other questions out there? Okay, so we are going to call that for now. And if you have if we hang up and it's like, oh my gosh, I forgot about this, this, and this, you can call us. There's our number. You can ask me a question. You can set up an appointment. And if you're really still not sure and you really want to talk to me about, I don't know if it's right for me or whatever, we can do just a quick little consult over the phone, just a free 15-minute guide, and just answer any more questions that you might have if you want some individual questions. Oh, wait, sorry, one more. And this is a really good question. It's private, but I'm going to answer it out loud. And the question is, will it help with chronic yeast infections? You know what? The Viviv will help with chronic yeast infections and UTI. I forgot to mention that. It's very important. Reason being is that you are changing the cells in the vaginal wall and you're creating a more livable environment with healthy cells. I've seen it affect both the vaginal bacteria. Now, it's not scientifically proven. So if you look it up on Viviv.com or whatever, you're not going to see that. But as a physician, I've seen it help with UTIs and I've seen it help with yeast infections. Of course, there's a myriad of other things we do with yeast infections, but it definitely is helping that in a lot of my patients as well. So, got that last question in. All right, thanks so much. I'm so happy that you checked in with me today. I hope you felt like it was worth your time, and I hope to see y'all soon. Bye.